to the June 9th, 2015 meeting of the Pitt County Board of Social Services. In the absence of our chairperson today, Melanie Bryan, I will be presiding. I call this meeting to order. And let us begin by taking a moment for silent prayer or meditation. Okay. The first item on our agenda is the opportunity for public comments, and Susan, I believe you say that nobody is signed up. So we will move on to the next agenda, which is the approval of today's agenda. And I
have moved that we approve the agenda as presented if there are no changes, Madam Chairman.
Do I have a second?
I second.
Me too. All in favor?
Aye.
Aye.
The agenda has been approved and accepted. And next we have our minutes, which are located in your packet from our May 12th meeting. Are there any questions or changes to those minutes as presented?
If there are no changes, I move that we approve the minutes as mailed, Madam Chairman.
Do I have a second?
Second.
All in favor?
Aye. We'll get you in the minutes.
All right, well, moving right along here to the item for our consent, and this is a budget amendment reflecting the receipt of the additional funds from the Casey Family Program in the amount of $10,000, and there are no county funds involved. And Jan, is there anything that you want to add to that?
No, this is for the Parent Partner Program.
Okay, all righty. Do I have a motion to approve this item for consent?
So moved, Madam Chair.
Second?
All in favor?
Aye.
Okay, the item is accepted. The other items on the agenda today is a report from Ms. Elliott on the Work First drug testing policy, which I believe is coming up.
That is correct. Starting July 1, Pitt County Social Services, as will all the county departments of social services across the state, we will be implementing Work First drug testing. This was adopted by the legislature, and there have been administrative rules established. There are still a couple of issues with those administrative rules, and so the Social Services Commission will be meeting to finalize a couple of things, and then it will go back to the Administrative Review Commission. But basically, the things that we are talking about now in that administrative rule talk about controlled substances. And I put definitions up there for you. We're talking about a controlled substance such as a drug, substance, or immediate precursor. It will require a drug test, which means production or submission for chemical analysis. It will be talking about illegal use of drugs, so that is unlawful use of controlled substances, and talking about reasonable suspicion. So you have to have a sufficient basis to believe the individual is engaged in the illegal use of drugs. Okay. So we want to talk about who this applies to. It will apply to all applicants for Work First who are 18 or older who will be included in the case. You have to be a recipient of Work First at Review that's 18 or older who will be included in the case. So basically you're talking about the parent. It does not apply to minor children or relatives that are not included in the Work First case. Just to give you a sense of numbers, in May of this year we had 48 applicants for Work First. We had 396 cases active for Work First, and about 1/3 of those 396 cases contained an adult. So we're talking about a very small number of individuals that this will apply to. So what is reasonable suspicion? It's defined as a criminal conviction relating to an illegal controlled substance within the past 3 years, or a score of 3 or above on the verbal screening questionnaire. This is the Drug Abuse Screening Test Instrument, or the DAST. And so we have included for you a copy of what the questions are that are on the DAST so that you can see those. They're on the screen. And if you answer yes to 3 or more of these, then you would be considered for the actual drug test. So just a couple of them, I'm not gonna read them all, but like, have you used drugs other than those required for medical reasons? Have you had blackouts, flashbacks? Have you neglected your family because of your use of drugs? I mean, these are some examples of the questions that people are going to be asked as part of this screening process. The drug testing requirements, these are going to be a condition of eligibility, and refusal to complete the DAST or declining to submit to the drug test or tampering with the drug testing in any way will result in ineligibility for that adult for cash assistance. So the children might still be eligible to receive, but that adult's needs would be taken out of the budget. They will receive a 5-panel drug test. We'll be looking for evidence of marijuana, cocaine, amphetamines, opiates, or phencyclidine. That one was a test for me. And I wasn't even sure what that was, so I have looked it up. It was developed in the 50s. It's an anesthetic. Its street name, or one of its many street names, is angel dust. And so that would be what we'd be testing for. Okay. So there are reasonable accommodations that shall be provided to the individuals with disabilities so that they can comply with the drug testing. We have to make sure that we are able to do that for folks who do have disabilities. Failure to complete the drug test within 12 business days and provide documentation of incapacity. Those folks, if they provide documentation of incapacity, those folks may receive additional time to complete the test. Okay. And then there are a variety of notices. At application and review, you should receive a notice of rights and responsibilities, hearing and appeal rights, and conditions for retest. If the test is positive, you receive another notice. If the test is positive, we will refer you to a qualified professional in substance abuse who will provide information and determine results of completion or confirm satisfactory participation to DSS. Initial notices went out to the clients on the 18th of May, but they were challenged. So a new notice is being sent to the households next week, and there will only be to notify that only the adult will be the person sanctioned, not the entire household, which was originally said. As I said, some rules have been challenged, and they're going back. They're related to ADA and notices. So they'll go back to the Social Services Commission June 18th for clarification. If there are as many as 10 objections to these rules, then the whole thing goes back to the legislature for reworking. The testing is paid for by the state. We have not been told at this point who the vendor is or how the process will work. Staff training will start on the 16th by webinar. And NC-FAST is currently being modified to track all this information that we need to have tracked. We have not, as I said, we've not been trained. We also have not seen the policy yet. So this is all clearly subject to a little bit of potential change. But since it's starting July 1, wanted everybody to be aware of what this was in case you hear it on the street.
I have a
Any
question.
questions? Mm-hmm.
You said that in the case where drugs are detected, it's not filed against, it's not ruled against the child. But if the household has an adult there with the drugs going on, then how does the money is handled for the child or the children in the household?
Well, we don't have the policy yet on how that's going to work. There are a variety of ways potentially that could be done, but currently I don't have policy to address that. As long as the adult is completing the drug testing requirements, however, and going through the therapy, et cetera, they may still well be the recipients of that check. But we don't have the policy yet to know whether they'll have to have a payee or how that will be handled.
I have a concern about the reasonable accommodation.
Mm-hmm.
The second bullet, says failure to complete the drug test within 12 business days and provides documentation of incapacity may receive additional time to complete test. And maybe it's just me, but I have questions. Are they required to supply a reasonable reason, justification why they did not get that within that window of time?
Well, they would have to share with us what their disability is as to why they need additional time to get that test. So if, for example, they're in a wheelchair, and again, I have no idea where we're going to be sending the person to be tested or how that's going to be done, but suppose they can't get access to the location, then we've got to have time to work that out so that they can be drug tested and receive that accommodation. Again, having not seen the policies, I don't know what documentation requirements are going to be made in order to get
See,
that accommodation.
To me, this is very vague.
Well, it is what the rule states at this point.
Right.
So again, policy will be written around exactly how we handle that, you know,
Well, I would just like
specifically.
to, I would like to make my feelings known that is so vague that I'd like to see some parameters as to, you have to provide a justified and a list of what would be a reasonable reason that you didn't, within two weeks plus 2 days, 2 business weeks plus 2 days, were not able to supply that information. And then if you're justified, you can have the additional time, but how much additional time are you
I'm
allowed?
sure all of that will show up in
Yeah.
policy, once they write the policy. Again, the ADA piece is part of the things, or part of the areas that legal aid and the ACLU have filed complaints about and asking to be looked at again. But at this point, we don't have the policy that specifically says what's going to be allowable rule, as far as the justification, and how they're going to be able to document that. We don't have that yet. Again, this was sort of an overview based on what the rules are that have come out of the administrative
Right.
section.
Well, I'm interested to see how that's
I will
filled
bring
in.
those to you.
Good.
Next month, I'll slip y'all a copy.
That'll be good.
I'm concerned
Mm-hmm.
too. Who's gonna give the test?
We do not know the name of the company. They,
All
the
right,
state,
in other words, these 5 drugs you're talking about,
Mm-hmm.
they're gonna be tested for each one of those, is that
it's
correct?
a 5-panel screen, yeah.
And social service is not gonna have it, it's gonna be a company that's going to test them, blood and so forth, to make
It's
sure.
probably a urine analysis.
The
The
whole
company,
works.
it will be a urine analysis. The company, there were bids put out by the state. The state has selected a vendor. They have not notified us who the vendor currently is going to be or how we will access that vendor. So we are waiting for that information. But that vendor has to be a qualified lab that meets certain testing requirements in order to qualify even to bid. So.
You know that you're gonna have a lot of them to fail, don't you?
Well, again, I don't know that we're going to have a lot of them to fail. We may have some fail. Remember, we don't have a huge number receiving assistance now.
No, you don't.
No, as I said, we
Well, I
have,
hope you don't have
Yeah.
any.
we have
But
about
knowing the society
130.
today, you're gonna probably have more than you think you're gonna have.
Mm-hmm.
All right, now, and if in that household, say you have one, do you just test one in a household? Or you-
Generally, we only have one adult in these households. A few of them might be 2-parent households, but generally, it would only be one adult in those
And if
households
that
anyway.
adult fails, then what?
Then the adult is not included in the check, but the children still are eligible for assistance, and they would get a check for 2 people.
With a different
Or
payee.
3 people, or 1 person, or whatever. I don't know how the payee piece is going
All
to
right, the
work. They have
children,
not
how
told us
old are
that.
they most of the time?
They vary in age from 0 to 17.
All right, now, and those that are 17,
We do not test them, they're minors.
they'll just,
Right,
okay,
right. It's a condition of eligibility for the parent, not for the children.
okay.
And this begins July 1st.
This begins July 1st. And training, we get training and policy next week.
Any other comments or questions?
You said it was challenged.
There has been challenges to two of the rules that were adopted. One had to do with how the notices were being done. One had to do with some of the ADA issues, the disability pieces. And that's why they're pretty vague right now, because that is still up in the air. It will be reviewed by the Social Services Commission to respond to those concerns on the 18th, and then it will go back to the administrative reviews.
Did they come out
Folks.
of Pitt County?
I do not know where they came from. Again, they were
Just
probably the state challenge, yeah.
Will that cost come out of your budget? Who's going to pay?
The
'Cause it's
state
gonna be big.
legislature paid for this, is paying for this. They're paying for the drug testing.
Okay.
Now, the additional time and involvement that our staff will have, that's covered through the normal process, but
And a
they are
social
paying for the
worker
drug.
may accompany the person in question.
Again, I do
You
not
don't know?
have
Okay.
the rules on that.
Okay.
We will get the results of the drug test as it relates to these 5 drugs.
All right. Any more questions?
I just have a concern that they're so vague, and how do you train anybody with such vague?
Again, these are the broad rules, not the policy. These are the broad rules that came from the law. So they've narrowed it down there, and now policy will be written, very specific policy will be written about how we
Between
apply
now and
those rules.
July 1st.
It's probably already done, it just hasn't gotten out to us yet. But yes, that's why we're getting trained next week on the policy. And then we will implement July 1. Okay?
Okay.
It's gonna be a lot of on-the-job training.
It will be.
And Ms. Elliott, looks like you take the show today, because next we have the director's report.
Okay, I'm gonna make this very brief. The vacancy report, the financial report, and unless anybody's got questions, you can see that we are getting positions filled. We still have some vacant positions. You can see that we're finishing the fiscal year. We have 11 months at this point, and we are finishing under budget on expenditures, and over budget on revenue, so that's always the place you want to be. The next, unless anybody's got a question, I'll move on to the next item in the packet. The next item in the packet shows you what's going on with Medicaid applications and reviews. This was as of the last report in May, which would have been, I think it's the 27th, 27th was the last report. So anyway, you can see kind of where we are. We are making progress, slowly but surely. We're not where we want to be, but we are making progress. The state will continue to roll the reviews forward for the month, us into July, and then that will be the last month they are rolling when they do it this month, and they will do that on the 17th of June. Items of note that I have included in this report, and you will see that on my written director's report down near the bottom. The agency received a silver award from the Department of Labor for outstanding health and safety efforts, which reduced our illnesses and injuries and promoted safer working conditions. Our auditors will start auditing us beginning June 22nd, so there'll be a lot going on from that standpoint. You have a copy of a letter to Dr. Vosh in your packet, and it is a letter about food stamp nutrition and how the state is not meeting timeliness standards. There was a conference call this morning with the county managers, and we participated in that call where the state discussed with the managers and commissioners who were part of that discussion. Here in Pitt County, it was myself and Mike Taylor, where the state reviewed this warning letter. And this warning letter indicates that North Carolina's application process timeliness is at about 75.36%. Anyway, we are way down there. We need to be at 90% to be acceptable. This letter indicates that if we are not at 95% for the 6-month period of January 2016 through June 2016, the federal government will start withholding monies. That could be an $88 million hit for North Carolina. So that's why the state was meeting with the county commissioners and managers to make sure that folks understood how critical this was. Couple of things going on there. The state, Pitt County's processing time, we are above 90%. So we were doing fine. However, the state has realized in looking at all this that we were counting timeliness incorrectly. People should be able to use their benefits by the 30th day. We were saying the application had to be processed by the 30th day. That's a big difference. And all of our reports are set up to do 30 days. So there's some programming being redone, new reports being done. All of us are trying to rethink our own mindset of how this is to be done. I've been in, the food stamp business and other social services things since 1970. And in 1970, when we did food stamps, we handed you the coupon when your application was completed, okay? So when you did that, you met the 30-day requirement. But today, with the world of EBT cards and all the bank transferring that has to go back and forth, you've got to back those days up. And we just didn't make that connection. We're not the only state that is being sanctioned or has the potential for sanction. We learned this morning that there are at least 5 other states that have gone to this warning situation. So North Carolina is working really hard to get this resolved, and we are already talking in-house about how we're going to turn our train so that we can get this back on track. But without the reports, it's going to be very difficult to know what cases are due on which days. So we're looking forward to that. But we're already now starting to talk. We will get this case processed within the day of the application, if at all possible, within 10 days, whatever we can do to back this train back up and get it where it needs to be. But statewide, it's a big issue.
I have a question about that and a big concern, because at the same time, going through all of this new software that has not been easy, that has been more complicated to start with, and the workers have already been, they have just been going like a runaway train trying to get this caught up. Sounds like it's very unrealistic and unreasonable expectation on the part of the state or federal government, whoever it is that's requiring this to be less than a 30-day turnaround. I think somebody needs to back up and say, wait a minute, you need to rethink would it be acceptable.
Right, and you will see in the packet that I have given you, there's a statement for queries regarding FNS application timeliness, and this is some of the discussion the state has had with the federal government about this. The state has argued that point. Nationwide, the whole nation, the average processing time right now is at 88% timely. So the whole nation, when you look at that average, has been dropping because of a whole lot of things, from automation efforts in some states to the increase in the Medicaid applications to the TurboTax helping us file food stamp applications when you were using TurboTax. Just a variety of things have gone on. But the federal government, and I understand where they're coming from, at a point in time you have to say you cannot drop any further. Now, we've got to turn this around and get us moving in the right direction. North Carolina is reaching out to some of those states who are processing much faster than we are to try and find out what things they're doing. The other thing I will say to you is that it has been determined in looking at some of this that we all have some old tapes playing in our brains. And so we are asking for information that we might need for Medicaid, but don't need it for food stamps. And so we're holding the case, the food stamp case, until we get that information, and we don't need that information. We could have already processed that food stamp case. So I think I'm not happy with the way the letter's going or what the federal government's doing, but it is making us sit up and take notice and make some real changes as a state, which I think is really important to know.
Well, I'm sitting here right now, and I'm envisioning Melanie's expression, because that's been her big concern, is staying ahead of the deadline.
Right.
So with that, in Pitt County, how is this affecting Pitt County's performance as far as being within these guidelines? Are we on track?
Well, we don't really know, because the information I have is that we're at 93.87% processing time.
So we're very just within,
Except
Couple of
we're
percentage
using the 30-day report, because there is no 28-day report or 25-day report. The 30-day report is too old. We've got to back it up. But using the report we have to go by, we're at 93.87%, so we're exceeding the 90% standard that is used for the rest of the nation.
that everybody else had that prior understanding of. How long ago was it clarified as to the real window of time?
I can't answer that question. What I can say to you is that in some of the conversations with some of the folks at the state level, it was like they knew it, but they didn't know it. You write it down, you wrote it down, but the light bulb didn't exactly go off in your head that it meant you had to be able to purchase your food within 30 days. We all, those folks were just like me. They've been around for a long time, and they grew up with you have to be able to purchase you have to process within 30 days. They didn't grow up thinking you got to be able to eat in 30 days. I think we all understood the emergency food stamp rule, which is you have to be able to eat in 7 days. But none of us ever put that spin on the 30-day piece.
Jane, I want to ask this, on the food stamps and Medicaid support. Are we up to, but we don't want to get in the condition that we were 6 months ago.
Right.
How do we stand really on that?
Well-
They're not long lines and so forth
No,
like
sir.
we did
No,
have
sir. No,
at
sir.
one
No,
time.
sir. No, sir. Again, food stamps is in good shape.
Right.
There's a few things we need to do.
All right, now on the crossover,
The crossover, the
For
cross-training.
how are our employees doing as far as being able to do both of those to keep them online?
At application, we are taking in anything that walks in the door, the folks are taking those applications. So they're taking food stamp applications and Medicaid applications, okay?
And the same
Together,
person
the
is
same
able to-
person's taking that.
That's good.
That's what's
Now,
happening.
are all of our employees do on that?
All of the folks
They're
at
able to do
intake.
that.
At intake, we still have a few specialized pieces, but generally at intake, that is what's happening. At review, we have a whole different ballgame. For one thing, in Medicaid, we've been pushing reviews, so trying to train them in a new policy while you're pushing them doing the Medicaid reviews is not a good time to be doing that. The second issue is that we have determined, when we started trying to look at the reports to see if we could match up so that one worker could have all the cases this one person has, the reports in one area are put out based on the child's name. The reports in another program area are put out by the head of household's name. They're not alphabetized. So you can't.
Why?
Well, we're working on that. We're working with NC Fast to get us reports that we need so that we can then work on blending those kinds of things. And in fact, Mary Ravello worked with some folks in Raleigh today to get a special report run so that we can break some of these things out. But again, so it's a training issue because we haven't had time to train them. And then we've started to look at that, but it's the issue of trying to figure out what cases go together, and the reports aren't quite with us on that. So, but we're working that way.
All right, one more question. Do we have any state personnel here in Pitt County from Raleigh now assisting you?
Not
Have
right
all of
now.
them gone back to Raleigh?
They've all gone back to Raleigh. They talk with us weekly, and they are willing to have someone come and stand over our shoulder to see if there's anything they can do to help us. At this point, I think we have a good understanding of both the system. When it is working properly, we have a good understanding of the system. We have a good understanding of the policy. We are currently processing about 142 cases a day. We have.
How many employees are doing that,
Oh,
Jay?
gee. I want to say there's about 15 or so that are in the review section doing Medicaid only.
Okay. But those 15 doing Medicaid, they can do food stamps.
Not all of them, no. As I
They-
said,
they're
we have
not-
not done that cross-training
Yeah.
yet, nor have we blended the cases yet. But that is a goal for for the next
I
fiscal
hope so.
year.
That's the thing I
That's a
think that
goal
we
for the
need
next
to
fiscal year. If we can
put
get
high
over.
on our list.
We need to get over this hump
Right.
first. Now, I will say that our applications are very close, our Medicaid applications, you know, we were up around 700.
Yes.
We were down on the last report that I had at a we've been as low as 125. We bumped back up briefly to 135. I will tell you that, so that's very good. They have definitely come a long way. I will tell you that we learned this morning, we learned last week first, that the marketplace is sending the counties another 9,100 applications that they found. And so,
How many?
9,100.
Was that all?
Yeah, Pitt County has already gotten about 100 of those that are gonna have to be processed. We understand that there are 2 new reports, this is what we learned today, that we're gonna be getting from the federal marketplace that we're gonna have to be working. One of those has to do with duplicates, and one of them is a data report that's gonna require us to enter some data into the system. All this while the Medicaid folks are trying to process reviews. So, it's a trying time for those
And it
folks.
sounds like the directives from the government are unreasonable to me. And I just can't see, an unrealistic.
It's pretty consistent with history. Let's just put it that way. There's always been a history of making these kinds of requirements known.
Well, coming back to Melanie's face,
Yeah.
the expression on her face and her concern about not getting behind the 8 ball with the deadline.
Right.
And what is the date of the deadline?
Okay, they are going to, the state is going to roll forward the children's Medicaid cases on June the 17th into July. Okay, any reviews that have not been done. The adult Medicaid cases have to be manually done already. Pitt County right now, as of today, has a total of 4,623 cases that need to be reviewed. Those are current cases and cases.
4,000 how many?
623. Those are current cases and cases that have rolled forward. So we have made significant progress this month. We started the month with well over 5,000 cases. We had 4,641 reviews and 795 past dues. So we've made significant progress.
So, somehow I think I missed the deadline date
Okay.
that we have to reach 95% to be in
Okay,
compliance.
different story. That's food stamps. Food stamps. We're in good shape in food stamps.
Okay,
Okay. We're in good shape with food stamps.
okay.
We should be able to make that one personally. Pitt County. I cannot speak for the state. I can speak, Pitt County will have no problem meeting that.
Good.
Okay.
Okay, well, that's
Do you
nice.
communicate, I imagine, daily with the supervisors?
Oh, yes, sir.
And,
And many of the staff.
that's good, because, and are you having time to go across the river?
I do go across the river. I was over there 2 days last week.
Good.
So, I've been on the phone this week. I hope to get over, I'll be over there tomorrow. So,
I haven't been over there. I want to go. Is it all right if I go?
sure,
Okay.
sure.
I know,
Check in with
Scott,
Brian.
have you got the repairs and everything, that we worked on last year? Do they seem to be happy with those?
You're talking about the windows?
Yeah, the windows, and the painting and the fixing the wallpaper up at the top that was coming loose and all of that.
They've stripped all that, that's all been repainted in the foyer, and, you might want to speak, Jan, about the repairs over there.
Right, if you're talking about the windows that were initially supposed to be installed have been installed.
Yeah.
We had an incident a couple of months ago, and there were some areas that did not get windows before, so we're going to install windows there. We also, after the budget year, those are getting installed pretty quick, like before the end of the fiscal year. We're also gonna be moving a door, so that it has to be pass
Yes, that was
coded.
one of their
That's a
concerns.
That's a new issue that has come up, recently since that incident,
Yeah.
that I was made aware of it since that
Right, but
incident.
it's been,
So,
but I think that we need to get those things, and keep the morale high,
right.
and which to me is very important.
We have stopped overtime, with the exception of we're asking folks to work one Saturday a month. That's the only overtime we're asking folks to do.
And you think you can do it with that?
It's gonna be tough, but because people were working so much overtime and they were so tired, productivity was dropping, and productivity is now going back up.
Right.
So,
And I think Mr. Manager has a comment or
Yeah, I had a question for Ms. Elliott. Have you talked or presented the concept of workers coming in from out of county?
I did not do that yet, yeah.
I didn't know if that's something you still have a plate or not.
I do still have it on my plate, but I didn't want to talk about it without having information from you, so,
I've read the information on that, I'm okay with that
Okay,
concept.
okay.
Probably get to that.
okay, yeah, I'll lay that out. Last month, Wake County came up with an idea that we would like to emulate. Wake County offered any staff member from other counties who wanted to come in and work one weekend, and it was a Saturday and Sunday, which was roughly 18 hours, that they would pay them $20 per completed, correct case. And they had 42 staff from around the state who took them up on that. And in that one weekend, they processed 2,000 family and children's Medicaid cases. So Angela and I have been looking at the budget, and we feel like we have a little bit of lapsed salary, that we would like to try that the rest of June with some of the counties around us to see if we could get folks who could do that. So once we had the manager's permission, we were going to send that out and see what we could get done. We only have this lapsed salary, and it's a small amount of money. I only have this lapsed salary, this until the end of June, because in July we won't have any. So our goal would be to knock at least 500 of these cases out using temporary folks. They would be independent contractors, and again, we would pay them $20 per case. So if they could knock out 500 cases, that would be $10,000. That's what the cost would be.
I know you know about what it costs for the 500.
Mm-hmm.
We're gonna get it done for 10,000. What would it cost if we didn't get them? With
Well,
personnel and so forth.
Our own internal personnel would still have to keep trying to process them, and we'd have to go back to overtime if.
So that's what I'm talking about, overtime.
Yeah, so there would be a cost there, a time and a
Yeah.
half for some of these folks.
It would be more
It would
then.
be, yeah,
So
probably,
it's common sense tells you, we
Yeah.
need to do that, don't we,
Yeah.
Ms. Manager?
So I had proposed that to the manager, and
Yeah.
he has just now said that he believes that is
Well,
okay to
can
do.
I
That's
ask
good.
how the employees within the county feel? Like, there might be ones within this county who would like to do that, rather than giving that extra income to somebody from outside the county.
But because they're county employees, and I'll let the manager speak to that, but I don't believe that's legal.
We can't contract with them to do something.
We need to get it and do
as
it
a
now.
1099 employee or as a contractor, if they're already doing it in their normal day-to-day work. We can only have them come in and do it, if they're within 40-hour work week, they can do it within that 40-hour work week. If not, then it's time and a half on the weekend. So, and I don't know the differential of paying $20 per case compared to time and a half for the existing workforce. I assume that the method you're talking about, having out-of-county workers come in, is more cost-efficient.
I would think it's equally as cost efficient if,
And maybe more
and-
expedient because
right.
they're not so
Right.
burned out.
right,
Yeah.
right,
Perfect sense.
right. So, and it, like I say, it worked really well in Wake. They're doing it again this weekend because it worked so well in May.
Yeah.
So,
Well, the thing about it, it puts us up there with them, and they don't have all this work piled up behind it. They have to say, we've got to do this, and
Right.
but it's being
Right.
done.
I
right.
think our numbers too reflect, you may have already talked about this, I regret coming in late. I guess we're the second, correct me if I'm wrong, the second worst in, fourth
Fourth.
worst in the state.
But fourth worst in the state as it relates to the Medicaid reviews. We've already dropped off the radar with food stamps. We are about to drop off the radar with applications. And reviews is where the last group of new hires was going. So you can see where all the new hires, everywhere they've gone in, we are now doing what needs to happen. So this last group of new hires is coming on, and that should impact the review group. But to get them up to speed with this short time period is just not
Oh,
doable.
yes. Small.
So, but yeah. And some of the counties have done a really good job with getting their Medicaid caught up. But now their food stamps are climbing like crazy because they've moved those food stamp staff over. And we've left ours where they were so that they could get those food stamps done.
So, at this point, are the employees that were working on like the Medicaid and helping NC Fast temporarily, are they back in their regular departments now so they can get caught up in their regular departments? Or are they still helping NC Fast?
Let me start with the review workers. You remember we had a group that was just processing, a group that was prepping. We have now gone back to those folks are back in their caseloads doing both parts. And again, productivity is beginning to pick back. It had dropped off, but it's beginning to pick back up again since we stopped all the overtime and folks are getting a little more rested. The folks from food stamps and from applications are being asked to volunteer if they would like to volunteer, but for weekends. But otherwise, they're being asked to keep their own caseloads going. So yeah, everybody's pretty much back where they belong. I know that the intake staff have asked for volunteers to help out, and they have also offered to do a little bit of extra, maybe about 140 cases, if they would do those for reviews, if they would try to work those into their regular workday, but their application processing has to come first, because that is their primary job. So they're pitching in, helping each other where they can, but they've got to keep their own work current first. We have also increased the number of actions that they're required to do a day, and they are picking up the pace meeting that request. So obviously, it's been kind of a guesstimate as to what folks could do, and now that we've raised the bar, they're coming up to that bar. So they're doing a good job.
Staff is to be commended.
Staff
It
is
has
to be-
been a hard road, long road.
Right. And we are so close. I say we're kind of like knocking at the door. We just can't
Good.
quite make that hump. So we're going to do it. So those are the things that I had for you
Okay.
today. The only other thing I did want to mention, there is a notice of some information in your packet about cost trends in Medicaid that I thought y'all might be interested in looking at. And then the final thing is some other legislation that's going on, and this will be near and dear to your heart. And I don't have any of that in your packet, but Senate Bill 424 is suggesting that youth in foster care be able to receive foster care benefits until they're 21 rather than 18, as current law provides. And that cleared the Senate Judiciary Committee this week. The expanded eligibility would include youth who are completing a high school or general education degree, enrolled in college or vocational program, participating in an employment program, working at least 80 hours a month, or incapable of meeting the aforementioned requirements due to a medical condition or disability. They could live away from their foster family in a college dorm or other semi-supervised housing. This is just in the Senate. It has not passed all the way, but there is a lot of support for this. The House bill was looking at age 19, but the Senate bill has jumped it to 21. So
When and I'll go to
Okay,
Raleigh,
okay.
because we talked about this years ago.
Yeah, so just be aware, It is now moved to the Appropriations Committee because there will be a financial impact. But we all talk about you don't kick your own kids out when they're 18.
That is super.
And why should you be kicking out the foster kids? Because they wind
Well,
up on the
at least
street.
help them to get, to go to whatever higher education training that's gonna help them to be productive as adults.
Jan, what will this do to the CARS program?
The CARS program would probably go away, would be
Okay.
my guess.
Okay.
Because it's the same group that the CARS program is covering. Not every county has a CARS program, so this would get it statewide. So that I think is the big
And
issue.
then would the individual social workers keep their children? Or would they go, I know that we don't know all this, I know.
You're way ahead of the game.
But is your tentative thought that it would encompass a single social worker like the CARS does?
And I don't know that we've had a whole lot of thought about it. My assumption was it would be that there'd be probably something similar to what we do with CARS, but we have not had a lot of thought about it yet.
That would be super.
Wouldn't that be wonderful?
You wanna go, Gwen?
Of course, it's a whole different ballgame when you're talking about working with adults, because these would technically be adults.
But we've done
So,
that.
We
We've
have
done
with the
that.
CARS agreement, so.
Okay,
Okay.
Any-
So that's, unless y'all got questions, that's pretty much my report.
anything else?
I would like, I should have said this last month, but I would just like to commend the foster program and their month-long recognition of the foster care, and went to a wonderful banquet at the beginning of the month. And I just, my hats are off to all those brave and supportive foster parents and anybody who supports that program
It
for
is
these
a
children.
unique segment of our population. It takes special people to be foster parents, and I don't know what we would do without them.
Well, it was a privilege to attend the banquet, and I should have recognized that at the last meeting, but I think, and all of the employees are a part of that and work to support those
Yeah.
parents.
Good
They're
unit.
wonderful.
Good unit.
Thank you.
All right, if everybody will complete your evaluation, and nobody has any further comments, questions?
Move adjourn.
Okay,
Second.
second? All right, moved and seconded, so therefore we are now adjourned, record time. Thank y'all.
Thank y'all.